We would like to thank SAGES for the opportunity to present our work and the SAGES Research Committee for their support as this study was funded by the SAGES Robotic Surgery Research Grant. The last decade has seen an exponential increase in the utilization of robotic hernia repair. However, data regarding the effect of the robotic approach are limited to small case series and retrospective reviews. This study aimed to examine the perioperative outcomes and recurrence incidence of robotic inguinal hernia repair as compared to the open and laparoscopic approaches, utilizing large-scale population-level data. The New York statewide administrative database was used to identify all adult patients undergoing initial open, laparoscopic, and robotic inguinal hernia repair from 2010 to 16. Perioperative outcomes and estimated recurrence incidences were compared. Propensity score analysis was used to estimate marginal differences using a one-to-one matching algorithm. During the study period, over 153,000 initial inguinal hernia repairs were performed in the state of New York. The majority of patients underwent open or laparoscopic repair. A minority of cases were performed robotically. There was an increasing trend of laparoscopic and robotic hernia repair during the study period. Patients undergoing robotic inguinal hernia repair were generally older with higher rates of comorbidities, most commonly hypertension, COPD, and obesity. On univariate analysis, patients with robotic hernia repair had higher rates of any complication, 30-day readmission, 30-day ED visits, and longer length of stay. Complications were mostly cardiopulmonary in nature. There were no cases of wound-related complications with robotic hernia repair. While the study was not designed to specifically compare laparoscopic with open hernia repair, there was a remarkably lower risk of complications and recurrence with the laparoscopic approach, suggesting that as we are later in the learning curve for laparoscopy, we are seeing improved outcomes compared to historical studies. The unadjusted estimated cumulative incidence of recurrence was greatest after open and lowest after laparoscopic inguinal hernia repair. The overall incidence of recurrence was 6.7% at 5 years. After propensity matching, we found no difference in perioperative outcomes between the robotic and laparoscopic approaches. The robotic approach was suggested to have a higher risk of recurrence, but this was found to be sensitive to possible unmeasured confounding factors. Such factors may include surgeon experience. Compared to the open approach, robotic inguinal hernia repair had a lower risk of any complication and shorter length of stay. These differences persisted even after adjusting for potential unmeasured confounding variables. There was no significant difference in time to recurrent hernia. This study demonstrates that in the immediate perioperative period, robotic and laparoscopic inguinal hernia repair may be associated with comparable outcomes, whereas robotic and laparoscopic repair have more favorable outcomes over the open approach. Further randomized studies are needed to assess the clinical variables contributing to these outcomes. For a more detailed review of the data, please see the corresponding electronic poster. I'm also happy to answer any questions through the platform or via email.